My name is Brooklyn Richard. I am a sophomore and I'm currently majoring in biology. Did you know that there are more than 26 million Americans currently suffering from asthma and about 15 million Americans currently suffering from chronic obstructive pulmonary disease, also known as COPD? These two chronic respiratory diseases are often very difficult to control and to treat, which is why for the past couple of months I have been researching a Bluetooth sensor and smartphone app created by the company Propeller Health. Propeller Health created the Bluetooth sensor and app to help patients with COPD and asthma decrease their symptoms and increase their quality of life. So what exactly is the Bluetooth sensor? Well, first let me explain to you what a rescue inhaler is. A rescue inhaler is used by patients with COPD and asthma to give them immediate relief of their symptoms. So what Propeller Health did is they created a sensor which patients can directly attach to their inhaler. So in order to get the sensor, a patient just goes to propellerhealth.com and apply for the sensor. A patient then can go to the App Store on their phone and download the Propeller Health app. Once a patient receives their sensor in the mail, all they do is simply take the sensor and attach it to their rescue inhaler. This is a sensor already connected to a rescue inhaler. This is a sensor not connected to a rescue inhaler. So to sync the two together, all a patient has to do is click the button on the rescue inhaler, and via Bluetooth, data from the sensor will be synced with the Propeller Health app. So let's say a couple days later, a patient catches an asthma attack. All a patient has to do is use their rescue inhaler as normal. This rescue inhaler is used by pushing down a button. Once a patient pushes down on the button, the sensor will be activated. Data will then be collected and sent to the app. A patient can then go onto the app and see the date, time, and location that they used their rescue inhaler. This is an example of what the Propeller Health app looks like when a patient opens it. There are many customizations that can be made for each patient to help better their treatment. A patient can also get onto the Propeller Health app to see the humidity, the weather forecast, the temperature, and they can also possibly check the air quality of their location. Propeller Health did not just create a sensor for rescue inhalers, they also created a sensor for control medication. Control medication is used by patients with COPD and asthma to help limit or possibly remove their symptoms of COPD and asthma. The big problem with control medications is that 30 to 70% of patients do not properly use it right. So what a patient does with a sensor for their control medication is they simply attach it to the control medication. They also sync it with the app on their phone. A patient can then get on the app and choose what time each day they would like to take their medication. For example, let's say I choose to take my medication at 8 a.m. every morning. If I have not taken my medication by 8 a.m., I will then receive an alert on my phone. There are many benefits to using the Propeller Health app, and one of those is increasing the conversation between a patient and their physician. All the data collected in the healthcare app can be printed onto an asthma report and then given to their physician. This helps their treatment, better their treatment. A study done by Propeller Health with a control group filled with people who have uncontrolled asthma. A year after using the smartphone app and the Bluetooth sensor, 50% of those patients went from a status of uncontrolled asthma to controlled asthma. The Propeller Health sensor is currently free. The only downside is that every medication does not currently have a sensor. Propeller Health is currently working with pharmaceutical companies to further increase the amount of sensors they have. Coming from someone with severe uncontrolled asthma, I am very excited for this new technology and I am looking forward to using it in my day-to-day life. Thank you.